I'm Dr. Jennifer Beppel, a urologist specializing in female urologic conditions at Chesapeake Urology. I'd like to talk to you about diVa laser vaginal therapy and who is a good candidate for this breakthrough vaginal resurfacing procedure. The short answer is any woman who wants to reverse the effects of feminine aging and feel more like her younger, more sensual self are the right candidate. While diVa is a safe and effective treatment, it may not be right for every woman. Women, for example, who have had an abnormal pap smear test in the past, have exposed mesh, or a history of chronic vaginal infections should talk to their provider before moving forward with any type of vaginal laser. Women who receive diVa come to Chesapeake Urology with one or more of these vaginal conditions: vaginal laxity, when the vaginal tissue is overstretched; vaginal atrophy, which is vaginal dryness from a lack of estrogen, causing burning, itching, or decreased vaginal lubrication during sexual intercourse; painful sex or loss of sexual sensation due to the thinning of the vaginal tissue. There are several factors that contribute to a decline in a woman's vaginal health. For example, women who have had children or are experiencing symptoms of menopause, including vaginal dryness, may be interested in the resurfacing treatment to improve the quality of their vaginal tissue. Similarly, the natural loss of estrogen as women age and go through menopause can lead to vaginal atrophy or thinning of the vaginal tissue. Women who experience vaginal dryness, burning, or itching on a regular basis and do not want to use hormone creams should talk to a Chesapeake Urology provider about diVa laser vaginal therapy. The bottom line, when it comes to choosing this type of procedure, is to consider your quality of life. Any woman who suffers from the vaginal conditions I mentioned, feels less confident sexually, or wants to restore the sensuality and vitality they felt as a younger woman is the right candidate for diVa laser vaginal therapy. In fact, many women who have had diVa say they feel 20 years younger, more confident, and that their sexual relationships with their partners dramatically improve after diVa. Choosing diVa is a personal decision, one that providers at Chesapeake Urology are happy to talk to you about. Find out more and read some of our patients' personal experiences with diVa on our website, or call us to schedule your diVa consultation today.